Hi everyone, my name is Caitlin Torgerson, and I'm a lecturer in Applied Biomedical Engineering at Johns Hopkins University, and I am here to take you guys through a quick tour of this digestive data set that we've got here. As you can see, we actually have a little bit of the bottom of the thoracic cavity as part of this scan. We have the heart right here, and then we have the diaphragm, kind of following the contours of those underlying digestive organs. And then we get into the abdominal cavity proper. And we have the liver right here. We have the gallbladder. And we can see portions of the colon. We have the small intestines. We have some very well imaged high contrast vasculature here as well that we'll be exploring. But the first thing that I want to do is kind of take us through a top-down kind of tour. So as we are here now in the thoracic cavity looking down, we can see the heart. We have our airways in the lungs on either side. We see the aorta. This is the thoracic aorta heading downwards now. And this little gray guy right here, that is going to be our esophagus. And we know it's the esophagus because if we keep following it as we cut down through the data set, we can see that it eventually empties into this structure right here, which is the stomach. And if we keep cutting further, we can see the lumen of the stomach right here. We have the lumen of the stomach, and then coming around from the fundus to the body, and then we can wrap around into the pylorus here as well. And then if we take a different view of the system, so coming back down to an anterior view right here, again, we can see the liver, we can see the gallbladder hanging out just underneath. We do have the stomach right there, and I'm going to cut away and go past the stomach. And when I do that, again, we can see the lumen of the stomach right here, wrapping around into the pylorus. And then behind the stomach, now we can see that we have the pancreas right here. If we keep cutting further, we can see some other organs in the abdominal cavity, not necessarily digestive though. We do have the right kidney, and then on this side, we have the spleen up here, and then the left kidney over here as well. And if we want to be able to look at some of the intestinal anatomy here, we do see that we have small intestines kind of wrapping around in and among all of the various structures here, but we also have a really good view of the large intestine. I'm going to wrap us around to the side here, and then I'm going to cut away the liver and part of the rib cage to give us a better view of our ascending colon over here on the right side of the body. Here's our ascending colon, and where it comes up and kind of changes direction, that's our hepatic flexure. And then if we follow it coming around the front of the body, then we continue across with the transverse colon, and then it heads up back towards the spleen. And so we see up here that we have our splenic flexure, and then we continue down into the descending colon right here. Now, one more thing I'd like to point out here is some of the really clear vascular anatomy that we're able to see on this scan. So I'm going to start to cut through our intestines here and reveal what's underneath. And as we get there, this right here is where we have all of the various digestive organ veins merging together, these tributaries coming together to form our hepatic portal vein right here, and we can see that heading into the liver right there. And then if we keep going deeper, we're able to see the arterial supply here for the digestive organs. So what we see right here, this is the aorta, the descending aorta, the thoracic aorta coming down into the abdominal aorta right here. And as we come back out and start to be able to see some of the anterior branches, we have our celiac trunk right here, and then we have our superior mesenteric artery, which if we follow it, we can see it coming more to form there. We're not going to be able to see the inferior mesenteric artery because the scan stops at about the navel. You can see the bottom of the kidney right here, bottom of the right kidney. And so we're not going to be able to see some of the pelvic cavity features here. But we can also kind of double check our location here because we know we have the the superior mesenteric artery in the celiac trunk. But then we can also see that we have the renal arteries branching off and heading out into the kidneys. So we have lots of abdominal structures and landmarks here that we can talk about. And we also have some of these other abdominal organs that don't necessarily belong to the digestive system, but that we can use as very helpful anatomical landmarks as we're moving through the cavity.